Good evening, everyone. This is Yashri, and welcome to another podcast by Professional Orientation Science students. Today, I have Nefeli and Nadine here with us. This evening, we would like to present a case about a recent study by British Journal of Health and Haematology, also known as BJH. This study compares two vitamin D supplementation strategies in children with sickle cell disease, also known as HCD. Sickle cell disease is a disease that causes red blood cells to be disordered and break down. This disorder leads cells to die early, leaving a shortage of red blood cells and blocking blood flow that can cause pain. As we all know, vitamin D deficiency is high in children with sickle cell disease, according to BJH study. The rate ranged from 56% to 96%. Children with sickle cell disease suffer from various complex symptoms, resulting to often visit in hospitals. In hospital, a higher serum 25-hydroxyvitamin D, in short 25 OHD level, would be given to minimize pain-related and decrease emergency hospital visits. Therefore, BJH compared the change in serum to 15-hydroxyvitamin with the safety and clinical impact of two vitamin D supplementation regimens in children with sickle cell disease by taking a double-blind randomized control trial and comparing 300,000 IU vitamin D3 combined with 1,000 IU vitamin D3 to daily supplementation in children with sickle cell disease. The study of BJH aimed to assess the efficiency of supplementation to raise 25 OHD to sufficient levels and the safety of intervention. Moreover, collecting experimental data about clinical impact of the vitamin D bolus, children aged between 5 and 17 years old who attended the sickle cell disease at St. Justine's Hospital in Montreal between November 2018 and September 2019 were eligible to run the experiment successfully. Furthermore, the HSJ's Research Ethics Boards approved the study, as well as all participants' legal guardians provided informed consent. Informed consent is essential when involving participants that are under the age of 18. This study did not reveal participants' name and other private information details when the study was published, so confidentiality was kept in between researchers and the participants. The study kept important ethics in mind and processed the study well. Now, I will pass it on to Nadine to discuss about study design in detail.
Thank you very much for the introduction. Hello, my name is Nadine and I will discuss the study design a little bit more in detail. So from originally eligible 145 children, 79 were approved and finally enrolled were 40 children, where 2 of them were consent removed and another one had no blood drawn, so therefore they were not selected in the study. So only 38 children, they were randomized selected into 2 different groups, where 18 children received the vitamin D bolus and the other 20 children received a placebo. The allocation to these groups were done by the HGS pharmacy using computers. All participants had to take a daily dose of 1,000 IU vitamin D as per the current guidelines, additional to the placebo or to the D3 bolus. At the end of the study, which was done after 3 months, they did a follow-up at home, where they assessed the vitamin D intake through a food questionnaire. 13 children were prescribed calcium supplements since they didn't meet the requirement age-specific requirements for calcium. The main reason for this trial was to raise the vitamin D levels to a sufficient level. Another test that they ran during the trial was after 7 to 10 days and 3 months after the hospital administration, the urine calcium creatinine ratio was tested. 3 months post-invitation, the ionized calcium was also assessed, and the presence of the highest 3D levels, which is over 250 nanomole per liters. The families also received weekly calls to ensure no adverse event happened. To measure the vitamin D, high-performance liquid chromatography coupled with mass spectroscopy was used. Other factors also assessed were demographics, so therefore age and sex, the genotypes and the growth of the child using a growth chart for Canada. The degree of sun exposure was also evaluated using a questionnaire. Now I'm passing it on to Neferli. She will discuss the study results in more detail.
Thank you, Nadine, for that introduction. My name is Neferli, and I will be discussing the results, the sample characteristics, what they meant, and the statistical analysis. In this study, children between the ages of 5 to 17 were tested. They were both genders. They were in the SCD clinic at Montreal, at St. Justin Hospital, between November 2018 and September 2019. For the first 20 months, the 24-month study compared 25% of the children in the standard dose group of 12,000 IU monthly, corresponding to 400 IU monthly. There were no significant options. 38 out of the 40 randomized patients received vitamin D. Placebo. 18 children received the vitamin D bolus, whereas 20 children had the placebo. Demographics such as age, sex, genotype, growth, hematology, and biochemistry parameters. A number of VD visits at the hospital admissions were extracted from the medical records. What did the results mean in terms of the study design? The results was good, but the sample space was not good, as the sample space of the bolus group and the placebo were not equal. The results were effective, as it showed that the aim was effective, but it was flawed due to the ineffectiveness of the results. Now, I'm going to talk about the statistical analysis. 18 children received the vitamin D bolus, whereas 20 children had the placebo. Based on published data, 98% of the children with CD received a monthly bolus of 100,000 IU vitamin D, where vitamin D were sufficient in the last 20 months. The usage was 5 per 7 days per week, and they would always receive 1,000 IU per day. There is the table that says adverse events, talks about the symptoms that the children had, and you see how many had which had the vitamin D bolus and the placebo. There is also another table that shows the levels of the HOD and the change in the levels between the baseline and the next 3 months. Now we'll pass it on to Nadine to talk about the strengths and the limitations of the study design.
Thank you so much for this very useful insight into the results. So as every study, this one also had its limitations, mostly being this was only a small number of children, so 38 who was finally involved and took part in the trial. It was also done in a very short period of time, which is only 3 months, which is not really, doesn't show you very much about the long-term results of the vitamin D supplements. It was only done in one clinic in Montreal, so the test was only done in one clinic and not in multiple, which would have been a better outcome. And only children over the age of 5 took part in this trial. So there is no data whatsoever about any children younger than 5 years of age. It was also only children who were at the hospital during November 2018 and September 2019. One of the positive effects though was during the clinical visits, there was 100% compliances and 100% retention rate of the participants. Another very strong limitation was that the children were given a fixed dose of vitamin D3, which was not adjusted to the children's weights or the baseline vitamin D, which meant that some children received 52 UI per kilogram per day, while others received 249 UI per kilogram per day, which is a very high difference. Thank you very much for your attention.
Thank you.
Thank you.